Our next speaker is going to be Victor Odero from the IRC, International Refugee Rescue Committee, sorry. But before that, before Victor, if you wouldn't mind, could we just take 1 minute at the beginning of your talk for silence, just for us all to reflect on what we've just heard. Thank you, Victor. If you would, I know you've produced a report on Tigray, and I'd be looking forward to hearing what you have to say. Thank you so much, Victor.
Thank you so much. Thank you on behalf of my colleagues at the International Rescue Committee for this opportunity to share with you insights from a recent report. The report is titled, "It is the Darkness That Scares Us, the Gendered Impact of Crisis at a Time of COVID-19, a rapid gender impact assessment, a rapid gender analysis in Tigray." The report was conducted between March and April of this year. IRC sampled 186 clients. 49% were women and girls, and 51% were men and boys aged between 18 and 35. The study also undertook a literature review, a desk review of 34 gender-related news reports from news agencies, UN agencies, and NGOs that were produced between November and March of this year. We also undertook a number of validation meetings to cross-check and validate the information. The major limitation that we experienced during the study was the breakdown in communication that made it very difficult for our field teams to communicate and present the findings back for analysis. The research was conducted by IRC staff members out in the field. The locations covered by the research were 7, 3 main locations in Tigray: Shire, Shimelba, Hitsats, Mayaini, Adiharush, Embadanso, and Maitespri. I'd like to mention that the report is a larger report that focuses its findings on livelihoods, gender-based violence, gender dynamics and social norms, and access to aid, including food, shelter, wash, and health. The main purpose of this exercise was for the IRC to understand how the crisis is affecting diverse groups from a gender perspective, and to ensure that emergency programming was responsive to the unique needs and priorities and constraints of the different groups. I must mention that the report is a wider report, and I will zero in now on the main findings that focus on gender-based violence and client safety, including sexual violence and conflict. One of the trends that we observed through the evidence was across the board low reporting of GBV. And this is not just in the media, where only about 18% of articles on Tigray mentioned GBV between November and March of this year, and of those, only about 6% discuss ongoing GBV. Majority of the cases reported to the IRC involved gang rape of women and girls, many of which are similar to the testimonies that you've just heard, and also consistent with reports that have been published so far. Reports that show that 50% of reported cases involve gang rape with more than 5 men, the perpetrators being Eritrean and Ethiopian soldiers and Amhara special forces implicated but not frequently mentioned. These incidences and these atrocities are being committed in people's homes, 39% of the cases, in military camps, 21% of the cases, while survivors were walking, 18% of the time, in hospitals, in open areas, and even in religious institutions. One of the quotes I'll just cite from the report. What they're telling us is that the Eritrean military have been sexually abusing them, including gang raping them. In one household, a father was forced to rape his daughter. That is one of many accounts that was documented during this exercise. I also want to mention at this point, one of the insights coming out of this report is to demonstrate that GBV is continuing, even for survivors beyond the initial attacks, and that GBV is on the rise and now more common than in pre-conflict times. This is attributable to social structures that are collapsing, lack of sanctions for perpetrators, fear of retaliation by survivors, increased alcoholism and substance abuse, lack of food, cash, disagreements and domestic violence is on the rise, and lack of reporting mechanisms and services. Another insight emerging from the report is the increasing social stigma against reporting gender-based violence and sexual violence. It does appear that there is a move towards prioritizing hunger, food, shelter, and other basic needs over sexual and gender-based violence reporting. This obviously has the effect of underreporting gender-based violence and also large unmet needs on the part of survivors. Lack of medical services for GBV survivors is a major issue. At the time at which the report was conducted, only Suhul Hospital had post-exposure prophylaxis. Health workers are not trained to receive cases, and survivors are being turned away, which just speaks to the low level of support that survivors are getting. Moving on. I must mention that is just a small extract from what is a wider report. But some of the recommendations that touch directly on responses and how we could support survivors is to treat GBV prevention and response as an emergency issue and make immediate investments to improve the quality of care and referrals for survivors, and also to address attitudes that seem to be downgrading or playing down the importance of GBV reporting and care. Given the lack of livelihoods and income and its contribution to women and girls being exploited in exchange for money to buy basic needs and commodities, it is important to have immediate investments to improve livelihoods and income targeting women and girls. It is also important to provide GBV case management and clinical care to sexual assault survivors, and to integrate GBV case management in the wider health response. The establishment of girls' safe spaces where women and girls and gender-based violence survivors can access basic emotional support, accurate information about services, and referrals to the services that they need is also important. To finish off, it is important that all staff of humanitarian organizations and agencies working in Tigray have mandatory training on the humanitarian principles and the organization's code of conduct. I'll just close by saying that our evidence shows that GBV, including sexual assault and rape, was not only systematically used at the start of the conflict as a weapon of war to subdue and intimidate civilians, particularly women. It is continuing. Thank you.
Thank you so much, Victor.